Hello, thanks for joining me. I'm Coach Chanae. I'm here from Academic Coaching for World Changers. I am here as your cheerleader and also your partner in preparing you to pass your exam. So please, while you're thinking about it and we're here, remember to please check us out on YouTube and subscribe to our YouTube channel. You can also join our Facebook group, Academic Coaching for World Changers, and you can see our website at www.academiccoachingchanging the www.academiccoachingforworldchangers.com. We also now offer Dr. Pam's practice written questions. It's on Brainscape. For only $30, you can gain 3 months of access using our exclusive discount. You can reach out to us at drpam2020@gmail.com. It's drpam2020@gmail.com. And you can take advantage of our discount to use these flashcards, which will help you prepare. So, during today's episode, I'll be talking to us today about the mental status exam. It's a type of assessment we use to gauge where our clients are at. So, if you're practicing as a therapist or really working with people in any capacity, you do this all the time. A mental status exam assesses a client's mental capacity at one point in time. So, remember, it assesses their current functioning. So, observations and implications on this exam can change as you see the client at different times or at different sessions. So, it's a fluid assessment, it's not just one point in time. So questions and observations used in this exam check the client's general appearance. It assesses their behavior, their movements, perceptions, mood, affect, cognition, including their attention, their orientation, memory, reasoning, and judgment. It's really a structured way to observe these different factors. So one way to remember this, what is assessed in a mental health exam, is an acronym that we can think about: ASPETIC. ASPETIC, ASEPTIC. Aseptic? Not sure how it would be pronounced, but it's an acronym meant to help you remember the different functions of a mental status exam. So I'll break each one down for you. A is the appearance. You want to be able to assess how your client is presenting to you. What do they look like? How is their grooming? Their eye contact with you, their motor activity, how they present. Do they appear like they have not showered in weeks? What is their mental status saying about their appearance? That's the A. The speech. You want to assess the rate of their speech, their volume, coherence. So if someone who usually talks in a normal, regular pace tone, but today they come to you very rushed and hurried in their tone of speech, you want to assess that. Their emotion, their mood, and their affects. So in emotion, you want to assess the observed emotion. That's their affect versus their mood is their reported feelings. And you want to pay attention to if those things are congruent or not. Perception. What is their mental status presenting at? Are they hallucinating, having illusions? What is their perception of their current reality? The T stands for thought, content, and process. Are they delusional? Do they have homicidal or suicidal ideations? Do they have a flight of ideas or blocking their thinking? They can't think of anything else except for these repeated thoughts, blocking. That is the T. And the I is their insight. Insight and judgment. Do they understand their illness? Are they able to make any sound decisions? What is their insight and judgment? And then lastly, we have C, their cognition. Are they oriented to time and place, person, their memory, their attention? What is their cognitive functioning? So again, that's the ASEPTIC: appearance, speech, emotion, perception, thoughts, insight, and cognition. So why is this mental status exam helpful or even important? So let's say you have a client who displays pressured speech, high energy, and flight of ideas. They may be experiencing a manic episode, or someone's presented with restricted affect, slow speech, poor hygiene. Are they depressed? What is happening for them? We have to assess, ask more questions. We want to determine if they're delusional, hallucinating, are their thoughts tangential, is their thoughts leading us to believe there is some psychotic thinking occurring? Using the mental status exam can help us observe and assess a client's current functioning in order for the therapist to determine treatment needs, diagnosis, and most importantly, immediate safety as well. So let's finish up with the question. So during an intake session, a therapist notes that the client presents disheveled, is not making eye contact, slow and monotone, and provides minimal spontaneous speech. The client reports feeling empty and has difficulty describing those emotions. Which in the mental status exam domains are direct implications by these observations? Their insight and judgment, A. B, their mood and affect, C, their perception and cognition, or D, thought process or thought content. So if you need to, you can rewind and re-listen to the question and the answer choices again because it's very important. Remember, this is a reading test. So think about what we're asking you and narrow down your answer choices to 2. And then we go back to the question and pick our best answer. And we prove our answer in the question. So let's take a second and pause, and you can do this on your own and give it a try. Answer the question. So if you came about the answer as B, their mood and affect, it's correct. The therapist's observation is primarily related to the effective presentation, including their restricted affect, their slow speech, and reported emotional emptiness. A speaks to insight and judgment. That speaks to awareness and decision making. That's not the information in the question. C is perception and cognition. That's talking about hallucinations, memory, orientation. None of those descriptors are provided. In D, the thought process and thought content, it would involve coherence or content of thinking. Again, that is not described. In the question, they're describing their presentation, eye contact, and their tone. Those things speak to their mood. So the correct answer is B. The therapist's observations relate to affect. So the other answers, we would rule those out as not being described. So thank you for joining me today. I hope that you have learned more about the mental status exam and what it entails. If you need more help, be sure to check us out on YouTube channel or book a session with one of our coaches. We are here to help you with an individualized plan to help prepare you for your test. Again, you can reach out to us at Dr. Pam, which is drpam2020 at gmail.com with any questions you may have. We'll be talking to you soon. Thank you and take care.